I am Shauna Wilson, and I am here to talk about how virtual teams in healthcare may have set a path for e-audits or virtual audits. Today, what we're going to do is we're going to look at these four aspects in this presentation. The first, I'm going to start out with telling a story. In this story, we're going to talk about how virtual teams and the solutions for healthcare may have set the trend for virtual auditing. The story is based in 2008, and technology, of course, is not what we have today, but the issues that they dealt with remain pertinent to today, especially when we try to address virtual auditing. Then what we're going to do in this presentation is we're going to operationalize the healthcare virtual team dilemma and put that into our world. Organizational context, risks, and opportunities. And from there, then we're going to talk about how to develop audit methods that will resolve those kinds of things with regards to the organizational context. And then we'll finally end with how to prepare an auditor for virtual auditing. Then what we're going to do in this presentation is we're going to let's begin with the definition, and that is, what is a virtual team? And put that in. A virtual team was also known as a geographically dispersed team or distributed team, is a group of people or individuals who work across time, space, and organizational boundaries with links to strengthen webs of communication using technology. So this is how we started with the virtual teams. Virtual teams actually got started in the early 2000s. In fact, right at the turn of the 2000s, we started seeing companies that were seeking to reduce their overhead expenses and by outsourcing or sending their employees that didn't have a need to be at the location home to work from home. And so that was a huge trend in the early 2000s. Now, how the companies set up that team to succeed, some failed, but some succeeded through that process. Those that did understood the team structure in working remotely, and some of the challenges. Of course, some of those challenges would be the inclusion of the distance that they've now created with their employees. And oftentimes it wasn't just the people in the same town. They started growing and with the supply chains, and now we have a time zone issue. And of course, everybody using their own favorite technology, and the need of the advancement in technology was so prevalent in those early days. The other aspect of this in setting up the virtual structure was the creations of culture, the online culture that everybody then found out that they needed to create, because trust and building trust relied on that culture, and of course, as well as the leadership of the management team and how they manage the people over these virtual teams. Advancement in technology. So they ended up depending on work processes, many of those that have succeeded in this. And in today's world, a lot of times the virtual teams outperform the face-to-face teams now, had they taken all these issues into account. So in this story that we're talking about with healthcare back in 2008 timeframe, what was it? So the healthcare, it was finding all these challenges, and it was looking for another way to operate like businesses to reduce their overhead expenses, and so they also started to turn to virtual teams. And some of the factors that included for them, because of the way they're organized, was the demographics of their organization, healthcare systems. They're already overloaded. You still had hard copies in those days instead of online solutions and computers. And also, it was an economic issue as far as being affordable, and that still is a problem today, but it definitely was a problem in those days. Think of how worse it would be if we hadn't made the advances in technology with the healthcare system that we have today. But the other aspect of this was the troubling capacity problem that the healthcare system itself was suffering with, both with the existing problems that it had with operations, but also future challenges, like the oncoming the baby boomer retirement, to speak of one. And so with this industry was really focused on, well, how can we break through this and improve this? So with the goal, their objectives were to have better access to healthcare, better quality healthcare, and then have better patient outcomes as a result of that quality care. One of the applications that they used for their virtual teams, and they focused this and made this narrow, which was a good thing, was what they called a virtual integrated practice, VIP. And their goal was to improve chronic disease management in primary care medical offices. So that was their goal. So the headlines, of course, at that time were reading the U.S. healthcare system is just a patchwork of competing insurance plans, and Medicare's spending is projected to triple by 2020. The aging U.S. population leading demographic factor shows that the baby boomers are going to be retiring. So from 2005 to 2020. So this is just next year. And then of course there's the crossing the quality chasm. So what are the leading issues that we have in the country? One, obesity, diabetes, cancer, Alzheimer's. All of these are leading in. And with the baby boomers' longevity in their lives, they're just living longer and more active. All of these could become more and more challenging for the medical health systems. Crossing the quality chasm. So this is an emerging issue, and these are the risk factors that they're facing. If we take a look at the need for virtual teams and for them to be turning to virtual teams, here are some of the obstacles that they have. One, co-located, so that's everybody located in the same area, or do they go virtual? So they're competing factors. And so one of them is the need for face-to-face care, right? When you think about healthcare, you think about got to be there face-to-face. And so what they established was that maybe that was in the box thinking, and that, everyone must work for the same company and they have to be face-to-face. Maybe they don't. Maybe there can be an alternative. The second area was about what they were training about, which was really surprising here, where their focus was the interpersonal development and communication. Well, that rides along with face-to-face being the most important aspect of their care. But what they did was they said, no, let's take a look at this, and we need to really have a focus on process, not interpersonal development and communication. Yeah, this is still important, but we have not yet focused on process and the importance of delivering quality care, meeting the revenue requirements, and achieving better patient outcome. So they changed their minds. This was a very different way of thinking. And with this, they transitioned to more of a virtual model. So remember, I talked about this being for chronic issues, with diabetes and these kinds of things. So they said, well, what kind of groups do we need? What kind of team members do we need to have? And that we could outsource, that we could bring in certified people in these areas. And so social workers, dietitians, pharmacy, occupational therapy were the four that they said, well, okay, what we can do is we can standardize processes depending on the need of the patient and assign them to these different groups of people, and then create a process where they're communicating with one another in this virtual environment. And they don't have to live in our town, they can be in other towns, so we can do an outreach to other communities. And so with this, they created these processes, or what they call protocols, And you would have within this regular blood work that would be scheduled, diet plans, alerts that go to providers if the measurements are off, those kinds of things. So they had a good feedback system that was occurring, and it was in a remote location. So what can we learn from the virtual teams for virtual auditing? Well, the first one is this face-to-face and this need to be on site to audit. Often when I'm auditing and virtually auditing, do you ever audit face-to-face? And I said, not much anymore. I mostly just do virtual. And does it make a difference? And well, no, it doesn't, because I can see a lot more in the virtual sense that I wouldn't be able to see in the face-to-face, because it's just right here at this one location. Now I can see everywhere. I can see remote locations. I can see all these other places. So that's a lesson. Let's not think about, well, we have to see something face-to-face or read somebody's nonverbal communication to, understand or trust them. Which brings us to the next one, is finding evidence of performance and conformity is more important than trying to interpret nonverbal communication. And I think we get hung up on that we don't trust or that we don't believe because we can't see their face. Then how do we know what to think about what they're giving us? Well, let's take a look at the evidence that they're showing us and really focus on that. It's kind of like the healthcare going from personal communication development to, let's really just kind of focus on the process and see what that's showing us. So I think there's some one-to-one correlation there. And then the last one is, if we understand all of the things that are going on with that organization, which is what the context of the organization has brought to us, then what we can do is we can think of multiple auditing methods that would be a better tool to understand if we have better conformance or performance to a requirement or to the process. So I think there's 3 of these lessons that we could very apply to virtual auditing. The other aspect that they have talked about in virtual auditing or in virtual teams. So we've had virtual teams now for 20 years. They've been doing this for 20 years. It's unbelievable. It's just gone by so fast. So what they do is they match technology to the importance or the aspect of the meeting itself. So if we look at this first matrix, and it's talking about the degree of collaboration that you need to have. One is simple and complex, and then the level of technology that you need is low to high. So with a simple level of collaboration, with a low part, you would have like email or more of a asynchronous solution, which would be a team bulletin board, right? And then if it's higher, then you can have instant messaging, because that happens all the time. People are chatting more than just going over and talking to one another, but we chat all the time. And then we have the teleconference. So that would be on the high end. Now, if we have the more complex collaboration that's needed, we don't even enter in with the low email aspect. We just go into the video conference and collaborative software. So now let's add to that collaboration actual tasks. So we got that simple. And so what would those tasks look like? Well, sharing information and idea and viewpoints. We can do brainstorming, and we can recognize others and socialize, all using emails, bulletin boards, those kinds of solutions. If we were to take it to the next part, the next level, the higher, we could do evaluations, right? This is like auditing. We can be doing this kind of thing. And that's at the simple stage. More complex, like building consensus, product development, solving problems, making decisions. These are all part of the video conferencing. solutions. They're all right there. And then what we've got for face-to-face is, okay, maybe we've got an escalation. Maybe we need to go and have the personal effect more so than what you would have with the virtual, and resolve the conflict, that kind of thing. Or maybe it's just time to party with all of your remote people, and you all get together for a planning session or something. So this is what virtual teams has set up, and they're collaborating and they're working together using this kind of technology matching to the collaboration level, right? And so virtual auditing fits right into this, and all of the aspects that we use for the technology and the different types of auditing that we do. So let's just go into this a little bit and talk about virtual auditing, or eAuditing, electronic auditing. First of all, and this is from J.P. Russell, he had talked about a site audit. This is a definition that he had put in years ago for an audit. So an audit is a systematic, independent, and documented process for obtaining sufficient audit evidence and evaluate it objectively to determine the extent to which the audit criteria are fulfilled. So a virtual audit or e-audit is the very same as that. So our face-to-face and our e-audits are following the same foundation. The only difference with an e-audit is that it's an audit that uses the electronic means to remotely obtain audit evidence in order to determine the extent of the conformity to the audit criteria. So with this, both groups, face-to-face, e-audits, we set up the audit plan, we can do interviews, we can observe operation, we can verify testing, we can analyze our data for our analysis from our data collection, and then we can report those results. We can do the same thing in both. So what virtual auditing is not, is and is not. So it is simultaneous. The auditing that I'm talking about is simultaneous. You will have an auditor that interviews an auditee real time. And they use a computer system and cameras or hand devices now, which are better, to do this. There's a system assessment, including record, including record control, procedure and process review. We have the auditee has control of the computer system throughout the whole audit. Now, what it is not is, it's not a desk audit. It is not you getting a bunch of emails from a client and just working through them for a desk audit. That's not what we're talking about. And also what it is not is, it's not an unattended auditor just reviewing, having access to somebody's computer and looking at their records in isolation. It's not that either. It's the same as a real audit. It's just in virtual. Okay, so now let's do a little bit of an exercise here, and let's apply that story that I just told about the medical care system, and let's bring it to our current standards of ISO 9001:2015 and the context of the organization. So what were some of the strengths of that healthcare facility? Their strength was to outsource to certified core competencies in companies or independent people, because all of those areas, the dietitians, social work, all of those people are certified. They have either master's degrees or they have some level of certification that they have to maintain. So that's a strength. They are able to pull that together. At the time, what they had, and maybe still today, a weakness can be limited technology or mismatched technology that doesn't talk to one another in a good way. Some of the threats, though, in this would be a breakdown of their processes or protocols, if that were to happen, and also if certifications became overdue or people did not update their certifications. So you'd have to have a process to make sure, like supplier management, to ensure that that happened. The opportunities, though, are enormous. You can expand site or statewide if you're in a state. So I've got a state here. It's not the state of the story, but here what we would have is, the state of Idaho here, they've blocked off all the main sections of the state, and you could take your virtual team, which is the healthcare provider, and their virtual team with dietitians, pharmacy, occupational therapists, and social workers, and plug them in any of these places to give better access to the state of Idaho, right, for healthcare for these chronic areas or chronic issues. So that would be one solution for the virtual team. But we could also audit that. So what would our audit plan look like that? So audit plans, in my opinion, do not look like just a review of the requirement standards. It's actually setting up a matrix like this one that talks about, well, what are we looking for? Are we looking for performance, or risk and opportunities, or supplier management? What type of audit are we needing to do? And then the methods. We have face-to-face. When would we do our face-to-face? We would have the eAudit. When would we do the eAudits? We could have a document review, because that would work still too. And then we could have performance results. So that could be testing or anything like that. And that would probably roll into both the doc review or the audits themselves as far as follow-up. But not setting up a process like this does not necessarily, I think it doesn't approach all the risks and opportunities that the context of the organization reveals going through that exercise. So in this case, what I've got down here is you could do an e-audit using the standard ISO 9001-2015 with the medical provider, right? And then look at their supply chain management and working into all of those different groups, the outsourcing of the different disciplines that they had. And what's the doc review going to be? Well, the minimum records that they need to be keeping. And then ask the question, what's your performance results looking like? With your supply chain management, your protocol requirements, are they being met? And then the standard process management, are all of these things being met within the requirements? But you can go down to that next space with performance and also obtain from that same audit. What I like is the performance of access, quality, care, the patient outcome, not individual patients, but overall. Is diabetes now going down in your area, or is it still rising? You can trend that as a company. And then have service evaluations. How well are these people working for you? You can have customer surveys. And the other thing that you could do is you could have people go in and, the blind audit where you go in and send somebody in and see what kind of service they get at these different facilities if you need to do that. And that would certainly be a performance audit. So that just really opens up the possibilities of how you could be doing this auditing. And most of this could be done virtually. So and then we look at that risk and opportunity and that supplier. You're still going down that supply chain audit path, and ensuring that the protocol performance and the certifications are being renewed, and that all of the other regulatory requirements that are being met for the different disciplines like social work and the occupational therapy, et cetera. So this is a better holistic plan, and it includes several different auditing tools. This is what I think auditing plans should look like in today's world. Okay, so let's go to this next part here. So what are some of the barriers that we have as auditors, the communication barriers? So part of the problem that's been going on for so long is the auditors themselves. They've just been on planes, and this virtual organization just kind of hit without it, it's invisible. It wasn't visible. And auditors in airports, talking on phones, they just really missed all of it sitting there. So many of them don't have experience on how to build trust online, how to problem solve complex issues online. And, it really illustrates the auditor's inexperience to facilitate, participate in virtual audits. And there's a lot of, oh, I can't see that working. It will never work. And that's I think we need to just really look at that barrier and say, yeah, it can work, and it's okay if you don't want to do it. You can still do the face-to-face, but it's a barrier. It's a barrier that auditors need to get past, because the companies that we're auditing, they're past it now. So here's an auditing plan to consider if you're really wanting to get into this, and it's really nice to be able to do this, is learning the eAuditing process and the techniques, and working with technology, right? So getting really comfortable with the technology that we use, the collaborative meetings, being able to use the computer. So if you're not used to doing that, you need to practice that. You can Skype with your grandkids and practice that to get more comfortable with it. So the other part of this is, which is the heart of this, is still people, they still need to validate issues using nonverbal communication. It's really hard for them when they can't see the person. Most of the time you can, but they're not the ones to look at. It's the process that you need to look at. And with the technology, with hand devices and the cameras that we have these days, there's just no reason it's not happening, because you can see everything the same as being there in today's world. So it's that nonverbal communication issue that's holding you up. Then just practice with the technology and ask questions and use the process of auditing rather than depending on that nonverbal communication. How to conduct online meetings. Work with other people to do online problem solving. So get on with another auditor or some other team members and solve some problems online using the whiteboard, using share features, those kinds of things, and get really good at that. And also bone up on some of that learning style information. So the visual learner and the audio learner, all of these all come into play in this new environment. It's all switched, of course. The audio people love this environment more than the visual, but it's all changing. It can be good. And then the technology. And I talked a lot about that already, but just practice, and you'll feel better about it. The next part is the internal auditing. So facilitating with internal audits or external, if you're a registrar. Use the standard auditing process for collecting the data. So you need to understand all of that. You need to understand the standards that you're working from as well. But also you need to decide what's the best audit model. So that matrix that I showed you earlier, pinpoint it. What is the best audit model that we should use to collect the information and be more efficient and more effective as far as looking at the information and making your judgment as far as if it meets the requirements of the standard. So that's all I have today. What I do recommend is, if you want to do virtual auditing, to get the necessary training, and it will add another tool to your auditing package. Thank you so much, and you take care now.